Good evening to all. The 53rd medical term that we'll be discussing is histamine. What is histamine? Of course, it's a chemical, but it acts as a messenger. Just like hormones, this is also a messenger involved in immune response. So generally, we know immune response means it's a opposite effect against a foreign antigen as a defense mechanism, not to protect our body, right? So when a human body is exposed to certain allergens or triggered by even as a gastric acid secretion, or this can also work as a neurotransmission in the brain. So histamine has is generally known to be an allergic immune response component, but it can stimulate gastric acid secretion in the stomach and also works like a neurotransmitter. So it partially involves the nervous system as well. But if you look at it, it's the nature of it. It's a protein, so there should be amino acids that make this up, and it's mainly by the amino acid histidine. And where do we really find this? In cells, like that is the blood cells, like basophils and mast cells. And as we know, basophils and mast cells are interconnected. As in, basophils is a name given when they are in the blood, and mast cells when it's present in the tissues. So these histamines, when they are released from these mast cells and basophils, they go and bind with receptors. There are four types of receptor. H1 receptor, that is the one which is involved during allergic reaction, which generally increases the heart rate, causing vasodilation, and in brain, it can lead to wakefulness. H2 receptor available in the stomach lining, so it stimulates gastric acid secretion. H3 in the central nervous system, mainly the brain and spinal cord. They are autoreceptors, helping in dopamine and serotonin secretion. H4 is expressed on mast cells as well as eosinophils and thereby involving inflammation. But when you look at the histamines release, sometimes it can even lead to anaphylactic reactions, or sometimes there can be histamine intolerance. These are like conditions associated. This can happen due to nasal congestion. Or there's a condition called scombroid poisoning, where due to foodborne by eating certain fish. So, what are the medications that can reduce the uh, opposite or adverse effect of histamine? That is an H1 antihistamine like cetirizine, uh, and H2 antihistamines like famotidine used in GERD, and epinephrine, which is used to treat anaphylactic reaction. So, this is all about